WDET. I'm Robin Vincent. Since the pandemic, overdose deaths continued to decline in Michigan. This is great news, of course. Medical providers say the biggest difference is the availability of life-saving Narcan and peer recovery coaches helping people get into recovery. A Wayne County report just found that drug overdose deaths declined by 42% in 2024, and the trend is continuing into 2025. Still, experts say it's becoming harder to prevent people from getting addicted to opioids. Avani Sheth is the chief medical officer for Wayne County Health, Human and Veterans Services. She began this conversation with the Metro's Sam Corey, speaking about how they have significantly brought down deaths from overdose.
So we've had a 42% decline in Wayne County in overdose deaths in 2024. This is the first decline we've seen in years, and it really reflects the significant and meaningful progress we've made on the overdose crisis in Wayne County. County Executive Warren Evans has championed and really prioritized making sure life-saving resources get put in directly into the hands of Wayne County residents. So I'm talking about Naloxone and Narcan, making that easily accessible through our Well Wayne Stations initiative, which has nearly 100 access points across Wayne County, that has made a tremendous impact alongside countless providers. We're talking about harm reduction providers, behavioral health providers, healthcare systems, all of those frontline providers collectively meeting people where they're at with life-saving resources.
Overdose deaths are declining, but the rate is smaller for Black men in Michigan in particular. They died from overdose at a rate that was 2.7 times higher than their white peers in 2024. Again, talking about the state of Michigan broadly, but certainly there are a lot of Black men in Wayne County in particular. What accounts for this kind of disparity?
Yeah, so you're highlighting a very important point. We know that in every single one of our municipalities across Wayne County, there is an overdose death. So I'm sure that your listeners and the general community, they likely know somebody who has overdosed, right? So it affects all of our families, all of our communities. But we know that it affects more communities more so than others. And you're highlighting a very important population. So the Black population is disproportionately impacted by overdose deaths. There's also an older male population that is affected in our Wayne County data. I want to just highlight one important point here. Substance use disorder rates are generally similar amongst different race and ethnic groups, right? And so we're seeing certain groups who may be having the same level of substance misuse in their communities, but they're dying more, right? And so what we're seeing is that unfortunately, there's unequal access to resources and treatment. There's more stigma in certain communities.
I think this is a really important point that I want to highlight. What you're saying is addiction rates are very similar across race, ethnicity, what have you, but the actual death from addiction or overdose specifically is higher among particular groups, and particularly African Americans. Is that fair?
Yes, that's fair.
I guess I want to ask a broader question, which is that overdose deaths in general are dropping across the state, and that's been true for the last couple of years. How much of this drop has to do with us essentially coming out of COVID lockdowns, interacting more with one another in person and being able to access social supports in ways that we couldn't in 2021?
Yeah, so I think you lift up a good point. What we saw during the pandemic, unfortunately, overdose rates increase. Lots of different factors involved there, but limited access to resources and treatment and care. Coming out of the pandemic, we've had the opportunity to make tremendous strides at bridging those gaps and closing those gaps. We know with recovery, that is very important, right? That's a key piece about engaging people in recovery and having individuals continue to stay in recovery is that connection. And that is one major piece of it.
I think I want to get a better understanding of how do you get someone in front of the help that they need? I imagine this is a really big issue. I know obviously there's advertising, but I'm wondering for folks who need the help, but don't know where to get it, how do you get in front of them, especially when it's stigmatized, when they don't necessarily want to talk about addiction or a mental health issue? How do you actually get in front of folks?
I think you're highlighting an important piece here. I think just talking about it more is important, right? Recognizing that substance use and substance misuse is common. It affects us all. It affects all of our communities, all of our families. about 1 in 6 Americans suffer from a substance use disorder, right? So this is millions. We're talking millions of Americans, really, right? And so we really have to lift the stigma from what we typically kind of refer to as a moral failing with substance use, right? It's oftentimes framed as a willpower issue versus treating it for what it is, which is a chronic medical condition.
I want to push on this point a little bit more because I think it's an important one. I think it's one that people really struggle with. For folks who know someone who struggles with addiction, which, as you stated, it's a lot of people. What exactly would you recommend that they do if someone they love is in that position? And I guess what I'm specifically trying to understand is, I hear you saying don't stigmatize the person. You want to make it open for them to talk about these things. And that person is, I think, an important individual, an important factor in trying to get them help. But if they don't want it or they're not seeking it, that seems to cause a little bit of a rub, a little bit of a tension. If someone is in that perspective, what do they do to try to facilitate that kind of help that doesn't stigmatize, but does push someone in the right direction? It seems like a hard needle to thread.
What I would recommend is, really meet that person where they're at, because, everyone is at a different place in terms of what they're ready to do in that moment. There are steps people can take to make that one positive change towards something broader.
What does that look like? I mean, if you were advising someone and they're like, okay, do I listen more? Do I slow down? What should they do?
So I would say also is to involve providers in that space as much as possible, right? Nobody should feel alone in dealing with this, right? And so a healthcare provider, mental health provider, we also have really strong harm reduction providers out in the community that are really on the front line, meeting individuals who use substances where they're at and providing them resources and continuing to engage with them. There's people out there who are equipped to do this, who are trained to do this, and can work alongside families to provide the resources that are needed and help people engage on the road to recovery.
I think
one of
the things, one of the things I'm hearing is maybe a bit surprising or something I didn't expect, which is medical providers are not just for the person who's experiencing addiction and who's at more risk of overdosing. They are also for the people who are connected to those folks. And those people can leverage medical providers to help them through the process of trying to help a loved one and getting essentially the medical provider in front of the face of the person who's suffering from addiction.
Yeah, oftentimes the best individuals equipped to talking to somebody and engaging them are ones that have been on that path as well. And so what we have in Wayne County, and we work alongside these partners quite frequently, is these harm reduction providers and what we call peer recovery coaches. So these are individuals who've been along a similar path, who speak the same language, who have managed to rebuild their lives and on the path to recovery, and can really engage folks and meet them where they're at and work alongside families and partners and communities and healthcare providers to kind of support and do that engagement. And I would encourage everyone to seek that out.
You're listening to The Metro on WDET Detroit Public Radio. I'm Sam Corey, speaking with Dr. Avani Sheth, the Chief Medical Officer for Wayne County Health, Human, and Veteran Services. We're discussing overdose rates dropping in Wayne and the sticky problem of addiction that remains in Metro Detroit. Dr. Sheth, I want to talk to you a little bit more about this story of declining overdoses, which is good, but there is still a problem that your office notes has recorded 34 carfentanil-involved overdose deaths in 2025, compared with fewer than 5 annual deaths related to carfentanil between 2018 and 2024. I guess first, for those who haven't heard about it, what is carfentanil?
Though we've made tremendous progress, and that's something to be celebrated, and it's very hopeful, the work is not done, right? The drug supply continues to change and evolve in increasingly dangerous ways. And you're highlighting something we're seeing in Wayne County with the carfentanil. So we've talked about fentanyl, which has driven overdose deaths over the past 10 plus years. 4 out of 5 of our overdose deaths involve fentanyl, which is around 50 to 100 times stronger than something like heroin or morphine. So now we have carfentanil that has reemerged in the drug supply that is 100 times as strong as fentanyl. So even really tiny amounts, super tiny amounts, can be deadly and can be very rapidly deadly. This year, we have a very good partnership with our medical examiner's office where we can, sometimes the death data comes to us later because there's a lot of confirmation that has to happen. And so what they're doing is that they're testing the samples really quickly to see if we're seeing any trends. And what we're seeing in those quick sample testing before confirmation is that it's likely nearly doubled this year so far, right? And so carfentanil is in our drug supply. It's in tiny amounts.
Why is it going up so rapidly? I just noted that 34 recorded deaths in 2025 compared to fewer than 5 annually between 2018 and 2024. Is just the supply is increasing? Is that the explanation?
Yeah. So what we do know is carfentanil is a much more smaller amount that it can be easily moved around the drug supply kind of channels. It's much more cheaper to produce and enter the drug supply. And so we think that these reasons collectively are likely the reason why they're entering the drug supply. Many people are not even aware that their substances they could be using could be contaminated with something like carfentanil. And that's why we're really trying to push this message.
It seems like over the last, 10 years in overdose research and addiction, that one of the stories is that the technology of drugs has just gotten much more potent. I mean, this was true of fentanyl, which is just cheaper, easier to produce, and it's quite highly addictive. And now there's carfentanil, and I don't know what's coming next. But I'm wondering what you make of that. Do you think that's fair, that it is becoming in some ways harder to reduce overdose deaths and to alleviate addiction when the technology is so, in a sense, profound? It's so strong.
Yeah, and what we're seeing right now, we talk about different waves of the opioid epidemic. We are in something called the fourth wave. More often than not, the drugs are containing more than one thing. So people may be thinking they're using cocaine, for example, but in fact it has 2+ substances in there. So what we're seeing right now is a very unpredictable drug supply that is rapidly changing.
Is that what marks this fourth wave different than the third or second or first wave of opioid addiction?
Yeah. So the first wave is what people think about from the 1990s, the prescription pain pills, for example, right? And overprescribing of prescription pain pills. The second wave is when we saw the heroin increase causing overdose deaths. The third wave was in around 2013 with fentanyl really entering the scene and really overtake heroin completely. Like we're hardly seeing, fentanyl has basically replaced heroin.
Because it's a much more powerful drug.
It's much more powerful. It's much more smaller quantities can be supplied through the drug supply. It's much more cheaper, and it is much more stronger. And then this last wave is what we're seeing is fentanyl mixed with many other substances. And so I think the biggest message here is that for people to be aware of is that the local drug supply, what you're getting and what they're doing is they're pressing it into these things that really look like prescription pills, but they're not, right? And they are oftentimes contaminated with multiple different substances. And that's why it's very important that our response also evolves knowing what's happening, right? We have to get something like Narcan out there to everyone because it's not only the person who has a substance use disorder that is at risk for an overdose, but it's also the person who is occasionally using.
And Narcan is so powerful just because it stops someone from dying. It just prevents that death.
Yeah, and it's specifically for an opioid overdose. So fentanyl, carfentanil, those both are opioids. There are things that are not opioids, unfortunately, in substances. What Narcan does is it basically knocks off the opioids in the brain receptors to bring the breathing back in minutes.
In closing here, I guess I want to just touch on addiction in general, which I know is complicated. It has both biological and social causes. What should we be investing in Michigan and in Wayne County in order to alleviate addiction and lower overdose deaths overall?
Yeah, so what we're trying to do is really have a comprehensive effort.
Should we have more recovery spaces? Just like I can find a rec center fairly easily, should I be able to find a public recovery space pretty easily in Metro Detroit? Is that more of what we should be investing in? I'm curious if you were talking to a lawmaker, someone in Lansing or in the federal government, what you would be like, hey, we really should be doing this. We're missing it right now.
Yes, so absolutely, recovery supports need to be expanded and more accessible. And so with something like addiction substance use disorder, it is not only the treatment, right, with the healthcare provider. It's all of that other wraparound recovery support that really helps people engage and continue and stay in recovery. We've done, in the state of Michigan, a really tremendous job of expanding recovery coaches or peer support, which we need to see more of. Because I would say that in working alongside peers, that member of the team is really priceless and invaluable. They make tremendous progress with communities. And so having more spaces for people to engage and talk through their recovery and really help navigate the system is so important.
Avani Sheth is the Chief Medical Officer for Wayne County Health, Human and Veterans Services. She spoke with the Metro's Sam Corey. Metro on WDET, Detroit Public Radio. And this station belongs to the people who listen to it. That means you. So once a year, we ask what you want more of. WDET's listener survey is open now. It's quick, it is anonymous, and we read every single one. Tell us what you'd like to hear. WDET.org/survey is the place to go. That's WDET.org. Coming up, we will remember John Jammin Collins, the Detroit techno luminary, known around the world as the ambassador of techno. This is WDET-FM, Detroit Public Radio, your connection to news, music, and conversation. And this is the Metro. We'll be right back after the news from NPR and WDET.